And they do this by taxing working poor, primarily by a massive tobacco tax that primarily falls upon families with less than $30,000 in income. That's right, Mr. Speaker. They're going to tax the working poor to give subsidies to those making up to $82,000 a year. In order to finance this program, the Heritage Foundation has concluded they're going to need 22 million new smokers over the next 10 years just to fund this program. The Congressional Budget Office has said that, in effect, they will also, in this bill, take family-chosen health care plans away from 2.1 million families and stick them with the government-run plan instead. They're taking children off of family-chosen health insurance and putting them in government-run plans. Every American child deserves access to quality, affordable, accessible health care. They deserve this kind of health care that we in Congress and our children enjoy, but that's not what they're receiving here. Instead, in a matter of years, when mothers in America have sick children, they will wait weeks and months to see a marginally competent doctor chosen by a Washington bureaucrat that may or may not do anything to help their children. That's not the way it ought to be in America. We can do better. Defeat this rule, defeat this bill.
Time of the gentleman has expired. The gentleman from Massachusetts is recognized.
Speaker, at this time I'd like to yield 2 minutes to the distinguished gentlewoman from Texas, Ms. Jackson Lee.
The gentlewoman from Texas is recognized for 2 minutes. Without objection.
Let me thank the distinguished gentleman from Massachusetts and the chairman of the full Committee on Ways and Means and the chairman of Energy and Commerce. This is correctly stated by the chairman of the Ways and Means. This is not the House bill. I love our children. I have great concerns about this legislation, but I have more concerns about my Republican friends who are opposing this legislation, and I am outraged about the president's threat of a veto. Even this bill barely covers the 6 million children that we need to cover. My friends, this is not Medicare. This is